One wing or two? This was a question a long time ago. It's pretty simple right now. There's problems with two wings. The problems are both directional and differential. If you splint two teeth together to, let's say, replace that lateral, directional mobility is every tooth is mobile, buccal, lingual. Well, the vector for a central and a canine, they're different. So now they keep wanting to move in different directions, and the bond is going to be stressed. So you have a likelihood of things debonding. Differential mobility would be the other one. If you have two teeth with different mobilities, the bridge wants to move with the more mobile one. So the one that is stronger is going to debond. So today, everything is a single wing. If you look at the success rates, single wing cantilevered Pontics, resin bonded Zirconia single wing cantilever Pontics, 10-year success rates are through the roof if you follow the guidelines of how to do the procedure. Here is a 15-year study by Matthias Kern. He is kind of the godfather of resin bonded bridges. He has 2 textbooks out. He unfortunately passed away last year. He was a gift to us to learn how to do these procedures. So here's 258 patients, 328 cantilevered resin bonded bridges. Cumulative success rate at 15 years was 97%. That's fantastic. He broke it down by which teeth he was replacing. So you look at maxillary laterals, mandibular laterals, and centrals. It is a fantastic restoration. Maxillary centrals, not as predictable. Why? Because it's a bigger tooth, it's a bigger Pontic that's going to have more forces placed upon it. So, which material? In the past, we would use metal. We would use base metal because we could do some etching of that base metal. Today, I think we're all leaning into using zirconia, which brings up the ability to design it, and it brings up how do we actually bond it to get the success rates that I just showed you from the literature. So I'll give you some of the guidelines for the wing and the Pontic design when we're going to be in zirconia. I have to have at least 0.7 of a millimeter thickness of that wing. So the shallower the overbite, I get more surface area, also get room to have the thickness on the palatal. If I have to prep for that thickness, then I'm going to start maybe losing some enamel, but I don't need much room. I need 0.7 of a millimeter. The connector is going to be the area where it's likely to fracture. So I need a connector that's 3 millimeters high, 2 millimeters wide. So then think about the anatomy of some teeth. You have smaller teeth. I might not be able to get the dimensions of the connector, and then my risk of fracture goes up. But I need to have a large connector, and I need to gradualize as I come into that Pontic.